Hi, my name is Maddie, and I'm a nurse practitioner student with Gonzaga University. Today I will be discussing the Phalen maneuver, the Tinel test, and the Finkelstien test. The first two exams, the Phalen and the Tinel test, are used to diagnose or rule out carpal tunnel syndrome. Carpal tunnel syndrome is a group of symptoms related to median nerve compression at the wrist caused by increased carpal tunnel pressure. This image shows the anatomy of the wrist and hand. As you can see, the median nerve runs through the center of the wrist on the anterior side and supplies sensation to the thumb, second finger, third finger, and the radial side of the fourth finger. Presentation that would warrant these exams are pain, paresis, and/or paresthesia of the median nerve distribution of the hand, as seen in this image. Other symptoms include decreased grip strength. The patient may complain about dropping things or having difficulty opening jars. The sensation of swelling and tightness, but without physical edema, and the sensation of extreme temperature in the affected hand or hands. These symptoms can vary day to day, but are often worse at night and can even wake the patient during sleep. The dominant hand is often initially affected and/or with greater severity, but bilateral carpal tunnel syndrome occurs frequently. For the Tinel test, the provider will tap over the median nerve. If this elicits the symptoms of numbness and tingling in the thumb, second finger, third finger, and the radial half of the fourth finger, then this is a positive exam. If the tapping doesn't elicit any symptoms, then this test is negative. A good way to remember this test is to think of the T in Tinel and T for tap. For the Phalen test, we will have the patient put their hands into an inverted prayer and apply pressure for 60 seconds. This compresses the median nerve like in carpal tunnel syndrome. If the patient experiences the same symptoms of numbness and tingling over that palmar area of the median nerve distribution of the hand, then this test is positive. If after this 60 seconds there are no symptoms, then this test is negative. A good way to remember this test is to think of the inverted prayer, and the P in prayer equals the P in Phalen. Finkelstien test is used to diagnose de Queve's tendinosynovitis, which is a painful condition affecting the tendons of the thumb side of your wrist. Patient presentation would often include symptoms of pain and/or edema near the base of the thumb, difficulty moving the thumb and wrist when doing activities that involve grasping or pinching, and a sticking or stop-and-go sensation of the thumb when moving it. For the Finkelstein test, have the patient put their thumb in their palm and wrap their fingers around. Put their elbow at 90 degrees and their wrist should be in neutral. Then have them slowly go into ulnar deviation at the wrist. A positive test will elicit pain over the abductor pollice longus and the extender pollice brevis tendons at the wrist and is indicated of peritonitis of these two tendons. Because this test can cause some discomfort in normal individuals, the examiner should compare pain caused on the affected side to the normal side. Only if the patient's symptoms are produced in the test on the effective side and not in the control, then this test is considered positive. Thank you for watching this presentation.